Hey everybody, it's Dr. Kevin Johnson, and I'm here to talk to you for just a few minutes about grief. I call this session Grief in Brief. There are three different types of grief that are most common among people who suffer a loss. One is anticipatory grief, another is conventional grief, and a third is complicated grief. I'm going to begin today with conventional grief because this is really the most common of the three that I mentioned today. So this is the process that most of us go through when we suffer a loss of some kind or another. I have on the board over here a brief outline of the Kubler-Ross model of grief that begins with denial, and then moves on to anger, bargaining, depression, and acceptance. Now, I think most of us are probably familiar with this particular model. I think it's a pretty good one. There are a couple of things that I want you to notice about it. First of all, if you notice this axis right here, as compared to this one, morale tends to increase as time goes on. And the other thing about this particular model is that while the model is on a continuum, this is not necessarily a linear process. So someone could work through the stages of grief and be at depression and wake up the next morning and find themselves extremely angry. And they could jump around. They could go back to denial, or from denial over to bargaining. So this process, grieving is a messy process. But I do think that these are the five most common things that we experience when we suffer a loss. And this is the model of conventional grief. Of course, grief is the response that we have to the loss of something or someone in our lives that's really important to us, that we care about deeply. And we know that throughout the process of grief, people experience changes physiologically, emotionally, spiritually, and even mentally. So over time, ideally, we adapt and we adjust, and we start being able to move on just as we might after a physical injury and some healing. Now, anticipatory grief is the next type of grief that I want to talk to you about. Anticipatory grief is that distress that someone might feel in the days, weeks, months leading up to an impending loss. And we see this a lot in critical care and in other areas of medicine. We begin to notice that people are anticipating a loss that is coming and it's affecting them deeply. So who experiences this? Well, a lot of times patients that have a terminal diagnosis will experience anticipatory grief. Their families, their friends, their caregivers also begin to anticipate the loss. And so they find themselves walking through a grieving process, even as they care for someone whom they know is dying. Also, any type of anticipating change can trigger anticipatory grief. It could be a change of job. Maybe you're moving on to a new career and you've really enjoyed working with the coworkers that you work with, and you're going to miss them very deeply. You have a pet that you have loved throughout its life, and you know that the pet is getting old and that the pet's not going to live forever. So you begin to start feeling those feelings of grief for that loved pet that you've cared for all of those years. Um, we see this a lot of times for people who are looking to receive an organ transplant. Anticipatory grief comes up a lot for them. People that are on the journey to an empty nest, their children are about to leave for college, and they just don't know what they're going to do with themselves after the child leaves. Someone who's been diagnosed with a degenerative disease might experience anticipatory grief. Caring for a child that has a chronic disease will often cause parents to anticipate grief. Someone waiting for an organ transplant, as I said, or someone who is looking at the amputation of a limb. Those are all areas in which we see anticipatory grief. So how does anticipatory grief present? How do we know if we're experiencing anticipatory grief? Well, when you're experiencing anticipatory grief, you begin to dwell on the fact that a loss is coming, and you begin to feel increasing concern for that thing or that person that you anticipate losing. You might experience regret over how your relationship with that person has played out over time. Maybe you didn't spend as much time with that person as you think you should have, or maybe you had an argument in the past that you now regret. But those types of things tend to well up when anticipatory grief is present. Also, a lot of times people who are experiencing anticipatory grief will start to rehearse a type of death ritual to go through the motions of the things that they anticipate doing when the loss for them occurs. My mom did that several years ago when it became evident to her that she and my dad were getting to an age where they probably weren't going to live forever. I went home one time and my mother took me on what I call a death tour. She took me through the personal papers and showed me where everything was. She took me on a little bit of a review of their lives together. She took me to their first home and shared with me some memories from that time in their life and marriage. And then she took me to the gravesite where they anticipated being buried. And she said, you know, this is our spot. This is where we're going to be. So make sure that this is where you all come on the day of our funeral to lay us to rest. And it was very sweet, but that was my mom going through anticipatory grief, rehearsing how things were going to be when the loss actually occurs. Also, sometimes we see folks really hyper-focused on the future when they're going through anticipatory grief, such that they are wondering, how is it going to be? How's it going to be in the future when I no longer have that thing or that person in my life? What's that going to look like for me? So, as you might expect, there are some benefits to anticipatory grief. Research shows that people who go through the anticipatory grief process have an easier time with this conventional grief process. They move through these stages a bit easier because they've already done some of that grieving in advance of the loss. Also, research shows that having a period of anticipatory grief can also predict whether or not the person is going to go through complicated grief. So it helps them and it helps the professionals around them put some resources in place so that they might have an easier time grieving when the loss actually occurs and avoid that complicated grief. So how do we cope with it? How do we cope with anticipatory grief? And how do we treat it in the clinic? Well, cognitive behavioral therapy is one method that's used for all of these types of grief when you're in therapy. Narrative therapy tends to really help for someone to sit down and write their story, to write what they're feeling, their experience, to write some memories of the person that they had, to maybe list those regrets that we talked about earlier. I really think that helps folks move on to the next level of grieving, because they're able to unburden themselves by putting those thoughts on paper. Also, if you have a pastor in your life who is trained in active listening, someone that's done clinical pastoral education, or any good social worker or mental health counselor can do some active listening with you. And that is, they listen to what you have to say, and then they can reflect back to you what you've said so that you can hear it out loud, and you can hear it in context, and you can hear how you sound to others when you assess your situation. So those are just some ways that we deal with anticipatory grief, and that is the second type of grief that we're going to talk about today. So we started with conventional grief, which is over here on the board. The second thing we've talked about is anticipatory grief, and now I want to move on to complicated grief. Now, complicated grief has gotten a lot of attention in recent years. There's actually an Institute for Complicated Grief at one of our Ivy League universities here near my home, and they do a lot of good work with helping people who are in the grieving process, and they're really, really struggling. So complicated grief, this is becoming so prevalent and so well recognized in the mental health community that in 2018, the World Health Organization actually added complicated grief to its list of diagnoses, followed by the APA in 2020. And it's also been included in the DSM-5, which is the manual that practitioners get diagnoses from as they're treating mental health disorder. Now, they don't call it complicated grief in those publications. They call it prolonged grief disorder, or PGD. So just know that those two things are interchangeable when you talk about them: complicated grief or prolonged grief disorder. So how does complicated grief present? Well, complicated grief is a form of grief that is persistent and pervasive and really interferes with daily functioning. It's characterized by intense yearning, longing, preoccupation with thoughts, memories of the person who's died. You might experience some identity disruption, a marked sense of disbelief. So you sort of get stuck in the denial, shock, disbelief stage. Difficulty engaging in everyday life, numbness emotionally. It's just hard for you to feel anything. Difficulty with relationships, intense loneliness as a result of the death. Prolonged grief just dominates a person's heart and mind all the time. It leaves them feeling like their future is empty and like they just do not know how to move past this. So what is the difference between prolonged grief disorder and just regular depression? You might be sitting there thinking these things sound a lot alike, and they do. Just know that prolonged grief disorder involves a persistent longing or yearning or preoccupation for a departed person or thing that was important to you, whereas depression involves more generalized melancholia. So who experiences prolonged grief disorder? Well, believe it or not, a lot of people. In the double-digit percentages, in fact, 10 to 15%, maybe about 1 in 6 is what we say. Anyone can experience this prolonged grief disorder. We see it prevalently, especially in people who were involved in codependent or fused relationships. So if you have somebody that you know that is connected to another person, and when you think about them, it's really difficult to know where one of the people end and the other one begins. And they're in that codependent, completely reliant on one another, and what we call a fused relationship. Those folks are at risk for complicated grief or prolonged grief disorder, because when one of the people in that relationship dies, the other one has a lot of trouble knowing how to move on without their other half. People who have a history of mood or anxiety disorders are also more susceptible to having prolonged grief disorder. People who abuse alcohol and drugs, people who have already experienced some depression in their lives, people who are caregivers and are completely invested in that person's care, and then the person passes away, and all of a sudden there's a void. They feel empty and they haven't done anything but care for that person, so they are left with a bit of a void and they don't know what to do or how to grieve appropriately. A lot of times people who are aides in people's homes, especially for hospice care and situations like that, these nurses and these medical aides will go in for 9 months, a year and a half, and they're ministering to the family 5 days a week for that long period of time. And they really develop a deep relationship with the family and with the person who dies. And when that person ultimately passes away, they find themselves for the first time being able to exhale and maybe experience some grief for this person that they've come to love over a period of time. If they don't adequately walk through these stages of grief and allow themselves time to breathe and to move forward healthily, they are at risk for complicated grief. A lot of times the circumstances of the death is a really important thing to consider. If someone has lost somebody from a drug overdose, for example, and the death was particularly traumatic, that death was unexpected, and that person died in a way that could have been prevented. So a lot of times we'll find the bereaved person stuck in one of these areas, anger maybe, or an intense sense of denial and shock, such that it's really, really difficult for them to get past that point. So they are at risk of prolonged grief disorder. It's also difficult if somebody's had a difficult childhood or a difficult upbringing, they're more at risk for complicated grief. If they have inadequate social supports or a community of faith, or they have serious conflicts with their friends and relatives, if they have major financial problems, all of these are things that put people at risk for experiencing prolonged grief disorder. So, what are some thoughts and feelings associated with prolonged grief disorder? I'll name 5 quickly. One is disbelief or protest. Another is where folks begin to imagine alternative scenarios. What if this had happened? What if I had been involved more with this? maybe that wouldn't have happened. Maybe it should have been me. Caregiver self-blame or anger. If I had not given him lunch, maybe he wouldn't have died that afternoon, right? Judging the conventional grief that someone has, and also survivor guilt. And what are some behaviors common in those that have prolonged grief disorder? Well, a lot of times they don't want to grieve. They get stuck in that state of denial, and it just hurts so deeply to grieve healthily that folks will avoid the triggers that make them grieve appropriately. So, for example, if you lost someone that you went to church with your entire life, you sat on the same road with them, they were a great friend, you might avoid going to church because that is how you remember this person. That is where you remember this person. You might go to church, but you might avoid sitting on that pew. Folks will have an inability to move forward. The next steps in life are unclear for them. And folks will have an inability to connect with others. So before I move forward with some ways that we treat prolonged grief disorder, I want to reiterate that a loss is not always necessarily a death of someone who is near or dear to you. It can be any type of loss. We see grief occur a lot of times in the addiction community. Someone who knows that it's time to give up whatever drug that they were addicted to, and they've done so, and they're committed to doing that. But that thing has been such a part of their life for so long that they miss it, and they begin to grieve along these lines, often, the loss of that substance. And it can be true of any scenario. Again, it doesn't necessarily have to be just losing someone that you care for. It can also be a situation that's very important to you, or something in your life that's very important to you. So when people are experiencing prolonged grief disorder, there are several ways to treat it. Throughout history, folks have mainly leaned heavily on cognitive behavioral therapy to treat it. But there is a new modality that social workers and mental health counselors are being trained in, where the therapist can help someone who is experiencing prolonged grief disorder move through a series of healing milestones. And by addressing each of those milestones, it lays to rest a portion of the grief that the person is dealing with and helps them to move healthily on to the next milestone in succession. They call these stuck points. You get to these milestones and then, you can't get beyond it. So that is your stuck point. And the milestones include the following. They begin by helping the person understand grief. What is grief? How does it present? How does it present in me? Then they move past that toward managing emotions. How can I manage the emotions that I'm feeling for this great loss that I have? From there, they help the person see a more promising future, to have a more hopeful outlook. Next is a period of helping the person strengthen their relationship so that they have good supports in place who can help them when they're particularly grieved or having issues and need that social connection to be able to move on to the next level. narrating the story of the death. Before I talked a little bit about narrative therapy and how important I thought that was for people going through anticipatory grief. It's a very similar thing here. The person who is grieving can write down the experience of the death itself and what their experience has been as they've walked through the process of grief. And it's helpful for them to unburden themselves by putting pen to paper and putting those ideas down, and hopefully leaving them on the paper or having a new perspective on them once they write them down. Next is learning to live with the reminders of the person's death. So those trigger points that we talked about before, how to be able to walk into church and sit on the same pew where my best friend sat for 60 years. Being able to do that and to manage that well. Also connecting with positive memories of the person or that died or the thing that you've lost is a really helpful thing as the last healing milestone, because when you're able to integrate some of those wonderful memories of the person that you knew and loved so well, you're really able to reach a point of acceptance and adaptation, and to move forward more healthily. So that's grief in brief. If you're experiencing grief, and especially if you're experiencing complicated grief, please reach out to a mental health professional or to your pastor, a pastoral counselor, a chaplain. Those folks are trained to help walk you through this process, or to be able to refer you to some resources where you can get the help that you need. It's really important to be able to live your best life, even in the face of death. And I hope that this has been helpful to everyone today. Again, I'm Dr. Kevin Johnson. This has been Grief in Brief, and please reach out if you need anything. All right? See you later.